While the traditional management of acute peripheral facial palsy has been a 10-day course of steroids and a 7-day course of antivirals by physicians and clinicians saying just to wait and watch. The large studies on this condition have demonstrated that more than 25% of the patients have incomplete recovery with long-lasting effects of chronic facial deformity and dysfunction. It is those patients that are diagnosed with Ramsay-Hunt and Zoster-Sinher-Petty are the ones that suffer from this incomplete recovery. Due to the vast majority of acute peripheral facial palsy patients regaining full recovery and the lack of definitive diagnosis of the etiology in each case, there has yet to be established a paradigm for identification and treatment for patients who may not fully recover. However, it has been shown that irreversible nerve damage is likely to occur within 3 weeks of the onset of the condition, and earlier recovery of function portends a much better prognosis for patients with this condition. Ask your doctor about the following recommendations. This protocol is based on successful clinical outcomes and research. If your provider is not familiar with the treatment of facial palsy, specifically with Ramsay-Hunt syndrome, contact us and we will connect you with one of our providers. We can be contacted at info@facialrecovery.com. Steroids are recommended anti-inflammatory treatment to minimize swelling around the nerve that's causing that disruption of the nerve signal. High-dose steroid taper for 3 weeks total is what is recommended. This is consistent with what is known about irreversible nerve damage beginning as early as 3 weeks after nerve injury, and is consistent with the established dosing regimen for sudden sensorineural hearing loss, which is the most similar sudden disease similar to Ramsay-Hunt syndrome that is from the cranial nerve system, or those nerves that are in the brainstem area. Typically, what happens if you're placed on a 7 to 10-day course of steroids, your symptoms are decreasing, your pain is decreasing. And then as soon as you stop the steroids, all of a sudden you start experiencing severe pain. And for those reasons, it is why we are recommending this high-dose steroid taper